Thank you so much. As Marty mentioned, mental health has really become and taken a toll on America's mental health as well as outside of the US. This is something we're definitely seeing. Researchers have shown from the CDC that the reports of anxiety, depression, and suicidal ideation were up significantly this year compared to last year's. And so I'm very excited to have some true experts from the field come and join me today. First is Erica Josa, who's a registered psychotherapist, maternal mental health specialist, and founder of Happy Mother. Hi, Erica. Thanks so much. Joining me next is Allison Orley, who is a clinical social worker and therapist, LMSW, and a heavy emphasis on maternal mental health and anxiety. Allison, thanks so much for joining us today. I know you had clients before and after this, so thanks for taking the opportunity to join us. And last but certainly not least is Dr. Mark Mayfield, who is a brilliant licensed professional counselor, LPC, a board-certified counselor, and founder and CEO of Mayfield Counseling Center. Thanks so much for joining us.
Thanks for having me.
Let's dive into this one. There's a lot going on, and as we've seen both in the comments today on our event today, as well as just on Mother Honestly, we're really seeing that a lot of our parents, especially mothers, are really struggling during this time. So I know this is going to be a heavier topic that we're going to address, but one that we want to tackle head on. We always like to say we are very honest at Mother Honestly, so I will be the first one to say that weekly I see my therapist. I am on medication that's making all of this go around, and today I actually put on makeup, so this is not always a normal thing. So what you see on social media and what you see on screen is not always what you're seeing behind the stages. So with that, one of the best icebreakers that I heard today was who's in your bunker with you. So Erica, we're going to start with you. Who's in your bunker with you as you're surviving the pandemic?
Well, I am a mom to 3 boys, ages 5 and under. So it's been a little intense and crazy around here, and hubby as well in my bunker with me.
That's great. Allison, how about you?
I am a mother of 3 as well. I have 6-year-old, just turned 6-year-old boy-girl twins, Maya and Ben, and then I have a 3-year-old daughter, Naomi. And then we have a dog, and then we have a dog we rehomed at the beginning of COVID. So we're all bunkered together.
That's perfect. And Dr. Mark, how about you?
Yes, so I've got 2 girls right now, and then we just found out about 5 weeks ago that we've got one on the way. So I've got a 12-year-old and a 7-year-old daughters, and then my wife is also in my bunker, and she's the co-founder of Mayfield Counseling Centers as well.
Congratulations, and thanks for sharing that with our listeners and our viewers. They're going to love that. So we're going to kick right into it. We're 9 months into the pandemic. Erica, the initial short-term crisis mode has been replaced by the overall burnout and overall decreased mental wellness, especially in moms and primary caregivers. What strategies and treatments are you advising? And then after you finish, Dr. Mark, Allison, please join in as well on this question.
Yeah, I feel like there's a couple of pieces to this. Moms and parents in particular run already at capacity, right? Like we are trying to parent, we're trying to work, we're trying to keep a home. And when I work with moms outside of the pandemic, we already feel like our cup is overflowing. And it's important for us to step back and look at these factors going on around us, like a pandemic, like childcare being shut down, all of these things, because those play a role in our capacity. So if you think about having, like, let's say I have my glass of water here, that's its regular size. It's usually already like overflowing. If we're talking about being over capacity, if we're talking about feeling like really empty and depleted, it's usually running on like nothing, right? The pandemic and the situation, like any situation that we're in, any crisis that we're in, any like loss of a loved one or different things that we're in, these things shape our capacity. They change the size of the cup that we have to pour from in the day. So one of the things that has been really challenging and that I've been trying to work on with parents, it's like we went through this first wave and we hunkered down and we just really kind of grit our teeth and bared it and worked our way through it. And now that there's this kind of like looming second wave, at least in Toronto, our numbers are kind of skyrocketing, and we're heading into a fall and a winter time that is very gloomy for parents to think about. And now it's like, I can't do this the second time around. Like, how am I going to manage? And so when I'm working with clients, we're thinking about things like, okay, what is the size of our cup? What is our capacity right now? And what is realistic? And how do we set effective boundaries to work within our capacity? Because what happens when we're being stretched right now, we're being forced to work outside of our capacity. But when that happens, we get like increase in anxiety and depression and suicidal thoughts and things that we'll talk about. These depressive thoughts of escape, which I spoke about in a post on Instagram today. Like lots of these things that take a significant toll on our mental health. So if we can step back and really evaluate, how am I going to work from a glass that's half this size right now? And what do I need to do to put boundaries in place to protect that for myself? And boundaries, if we struggled with them before, are really being exploited and challenged right now. I have a couple of other pieces, but did anybody want to chime in on talking about capacity?
Allison or Dr. Mark?
Yeah, Eric, I think that's really, really good. And I think one of the things that I'm seeing with my families and parents that I'm still seeing is that there's still a expectation of holding on to what was before the pandemic, of family expectations, of productivity expectations. And so I've really challenged my clients to reevaluate, if we look at the pandemic as a trauma that all of us have experienced, like, we're not going to go back to the way it used to be. And we've got to adjust in healthy ways to the way it is. And if that's grieving it, if that's recognizing the trauma of it. But one of the things that I've noticed capacity wise is just letting our kids be a little bit, and not having those expectations of perfection or A's or all the time or whatever that might be in school or at home. Because every behavior is pointing to a need that's been trying to communicate, and so when my youngest is throwing a tantrum, I'm like, okay, what's going on? This is affecting them and they can't put words to it. So I think just allowing for grace and for margin to be okay with not being okay.
Mm-hmm. Mm-hmm.
Excellent point.
I think also when discussing capacity, particularly for mothers, I had a mother honestly moment just now, because when I described my bunker, I forgot about my husband. So that very clearly, I think, represents how women are feeling. I feel like as a full-time working woman that I have this role to fulfill, in my job, but that I'm also trying to fulfill this role as mother and trying to maintain normalcy as much as possible for my family. And so this idea of multiple layers of roles being put on women. So yes, I definitely mother honestly moment. I feel like I'm part of the club now.
Very much so. And we appreciate you sharing. And it is a big thing, because even I think in your professional lives, you guys are, on one hand, you have to exclude this aura and calming nature for your patients and your clients. But then at the same time, you're going through the same collective trauma as everyone else. And I think if we take that lens off of it and just say, we're all in this together and it's okay to not be okay. So with that, I want to move into our next question, which I think, is going to really start to gear up quickly. Is that, and Allison, I'm going to start with you first on this one. The holidays are normally stressful pre-pandemic. There's a lot that goes into holidays when we aren't in this environment. And with some environments with some activities rather, that have been canceled, changed, or modified, how can people cope with the normal stress that comes with anxiety, with the holidays that's being magnified during the pandemic, with increased feelings of sadness, guilt, or grief?
Sure. So I think the holidays, yes, like you said, are automatically a triggering time for many people, because they are this archetype of memories, of experiences that we've had in our past, and they're sort of this benchmark in our life that we kind of measure things against. So already there's a lot of family dynamics. There's already a lot of personal dynamics that come into play during the holidays. So as therapists and mental health professionals, it's a time of year where we already see an uptick in mental health issues, but this year is going to be particularly interesting. I read an article in the Wall Street Journal that people can still look up and find about how in South Korea they recently had their equivalent of Thanksgiving, and talking about what the experience was like for them in the middle of the pandemic. And I did write down, the title of it was called "The In-Laws Will Have to Wait," which I kind of loved, because it was this concept of we don't have to maintain the sense of normalcy. And speaking about boundaries earlier, I think is really helpful as well, because a lot of the time we have perceived expectations from other people in our lives, particularly surrounding holidays. And this time of year, we're going to have to really remain true to ourselves and what our needs are. So one of the reasons I brought up my dog that I rehomed in the beginning of the pandemic is because I'm a big believer that if things are going to feel strange and unfamiliar, I think it's a good strategy to try to make them feel strange and unfamiliar in a positive way. So when we first went into lockdown, I had the opportunity to get a dog, and I said, okay, we're going to get a dog. I did not need another dog. I did not need more dog shit to clean up. But I got one because it was sort of like, let's take this experience and make it different in a positive way. And I think the same thing could be applied to holidays. Rather than having to drive around to everybody's house, like, let's take this holiday and reframe the way we look at it and turn it into a time where we truly connect as a family, where we're truly listening to what our needs are. One of the most important things about holidays, and I wrote this down because it was really important to me, was to remember that rituals are meant to have meaning to them. And I think because the holidays become bigger and grander every year and the expectations get bigger, we forget about that true meaning. So this is a good opportunity to reconnect with that. That being said, it is also more stressful. And so I'm a big believer in maintaining a support system, staying in contact with a mental health therapist if you have one, or finding somebody, outsourcing things as you can, making sure that you have clear expectations of what you can provide for your family. For example, finances will be particularly stressful for some people this year. And so having conversations with your partner about what the expectations are for the holidays, and having those be clear and concise, and feeling like you're on the same team. Also seeing that, I certainly am not trying to make it seem like it's all going to be rosy and everything's going to be go be simpler and better because of that, but trying to figure out a way to reshape the holidays. And if anybody else has any input.
Erica, Dr. Mark, any thoughts on what people can do to deal with the holidays right now?
I do really love that idea that that Alison was sharing, this idea of making new rituals and making new meanings right now, right? Not that we're not ever going to be able to return to our traditions and our rituals the way that they were, but it doesn't have to be. It will feel like a loss, and we can feel that loss at the same time as recreating something new and meaningful within our own little bunker, like you said, right? And I've had to do that for birthdays. I've had to do that for lots of celebrations that have felt outside of the norm, but we end up having like a big Sunday festival where we're making ice cream sundaes and like with the works, and it still has a very special meaning to it, even though it's different. And I think that it's important that there's room for both. There's room for the loss, but there's also room for new meaning and new rituals in this time.
Awesome. Dr. Mark.
Yeah, Eric, I like that. I think it's really important I always tell my clients, instead of looking at it as a problem, look at it as an opportunity and a challenge, because then it's a different mindset. If we look at it as a problem, we're going to see everything wrong with it. And focus on that. But if it's an opportunity and a challenge, like you said, it's what are these new meanings? What are the new rituals? What are these new things that we can create? And sitting with the hard. A lot of times we try to avoid hard feelings, and it's important that we sit with those and learn from them. And from that, one of my favorite movies for my girls is Inside Out, right? And so the interplay between sadness and joy is so important, and it's going to help us appreciate things, I think, differently and hopefully more.
Great perspective, and I love that movie. I've used that a lot with my toddler to help show emotions. So, Dr. Mark, I'm going to stick with you. How can parents identify signs of anxiety and depression in children, and what steps can they take to help treat that? Additionally, when is that line where parents should reach out to additional resources outside of the home if they're noticing their kids are struggling?
I think this is a great question, and I think it goes back to how much time are you engaging with your children. I think a lot of times we miss things because we've gotten caught up in the busyness of stuff, and so I think one of the opportunities and the challenges, but one of the opportunities of COVID is it's helped us refocus on what's important. And so refocusing in on our kids. And recognize that they're not going to express their anxiety and depression in adult ways. I think a lot of times we forget as parents that our kids are not mini adults; they're kids, and so their expressions of distress are going to be in maybe under eating, overeating. It might be in too much sleep, not enough sleep. It might be in just random outbursts that aren't indicative of your child, but they're trying to express themselves in ways that they only know. And so as parents, what are we doing to create space for them to emote and create space for them to express? And that we're not shutting down, quick to shut down an emotive, expression. My 7-year-old had a 2-year-old tantrum in Target the other day. And I'm like, okay, it was because she didn't get something that she wanted, but it was bigger than that. And so instead of shaming her and scolding her and that kind of stuff, just kind of sat on the floor with her and allowed her to emote. And then okay, let's talk about it afterwards. And try not to engage some of those emotive behaviors in disciplinary actions, because nothing good comes of that in those moments, but just to really sit with them and validate their emotions and where they're at. And it's okay as parents to realize maybe I need help. It's not an indication of being a bad parent if okay, this is above my pay grade right now and I don't know what to do. And so picking up the phone and calling a friend or a parent or a godparent or a therapist or somebody, a clergy or whatever your resource might be, to go, okay, I'm stumped. Like nobody's ever done this before. We've never gone through a pandemic together as a society. So can I just brainstorm and talk and receive help? I'm sure Eric and Allison, your practices have gotten a lot more phone calls as of late. We just have gotten a lot more phone calls of people. Can I just come in for a session or two and just kind of like bounce ideas off of you and talk, because I don't know what to do. And that's okay. And so to remove the shame that might go with I need help, because there's a strength in asking for help, not a shame in asking for help. And so I think, Kristen, going back to, how do we recognize? I think it's, are we creating space and time to be present with our kids in a way that we are able to look them in the eye, to sit with them in their energy and their presence, and to recognize if something's off, and then to explore that, be curious about it, to not ignore it, and engage that.
Excellent points. Erica, Allison, anything to add?
I appreciate so much of what Dr. Mark shared about being vulnerable with your children. I oftentimes reference with my clients, I am the first generation in my family that apologizes to my children. I was not apologized to. I was not encouraged to be have reflexive conversations with my parents, and both of my parents were therapists, so that's saying a lot. So I know that if I had that experience, a lot of other people did as well. And so one of the things that's been really important for me in my household is, as my kids are having outbursts, meltdowns, is really getting on their level and understanding I'm feeling like I'm hanging on by a thread sometimes. And if it's hard for me to process that as a 36-year-old woman, what does it feel like for them as a child? And so I tend to work more with parents. And one of the things I've experienced a lot is parents who are feeling guilt or shame about the way they've reacted towards their kids. And I'm a very big proponent of doing the repair work, attachment theory, this idea that your job is not to be a perfect parent, but rather, if you do something that you could have handled better or could have handled differently, modeling for your children how to repair that issue. So I use a lot of language like, okay, how can we fix this, rather than, timeouts or, that type of thing. So I agree with a lot of what he shared.
Mm-hmm.
Excellent. Erica.
I think that we fall into this trap of seeing our children's behavior as like a slight against us. Right? Like they didn't listen, they intentionally defied, and we fall into this mentality of our children kind of trying to oppose us in some way. But what I teach my clients is that a child's behavior is how they communicate with us. They don't have the words, especially when we're talking, like my kids are 5, 3.5, and 2. There is no like verbal, understanding of how to communicate their emotions yet, especially my kind of wild card middle one. He'll go Hulk on the whole house before I can get to the bottom of what's going on with him, like Hulk mode, we call it, right? But I've really had to train myself to see and understand that he has a need right now. And my responsibility in that moment is, one, to calm myself and stay regulated. And we'll talk about that in one of the questions coming up. That's my goal in that moment, is to keep myself as calm as I can. And then two, to identify what his need is in that moment. So our child's behavior is communication to us. And once we can regulate ourselves to kind of have some space between our reaction to the behavior and, trying to understand it, when we have a little bit of space, we can see it and frame it a little bit differently.
That's perfect. And Eric, I'm going to stick with you for a minute and dive into this a little bit more, especially with our mom, especially with a lot of our parents. There's this tendency to kind of hide our anxiety and our depression. People ask us, how are we doing? And we kind of say, I'm fine, everything's fine. And we try and we don't want to be a burden to others. Mm-hmm. But how do we help normalize these conversations and say it's okay to not be okay?
Well, I'm going to go out on a limb here and say we may think we're hiding our anxiety and depression, but we most definitely are not actually hiding our anxiety and depression, because it's kind of like whack-a-mole. You try and hide it and it pops up in another way. And usually it's irritability, or it's rage, or it's absolute, rage clean of the playroom because everything feels so chaotic and out of control. So I think that one of the things is important for us to know as moms is just avoiding and not talking about it out of shame or guilt doesn't make these feelings go away. And when it comes to, I believe the second part of that question is kind of how do we make it okay within our home to talk about these big feelings and sort of teach our kids how to deal with them? And that comes back down to modeling this behavior. So I'll kind of give you a little bit of a scenario of how Hulk mode might go in my house some days and how I have to play through that. It's yes, I'm very frustrated that there are toys being thrown all over the place. Yes, I'm at capacity. I've worked all day. I've seen lots of clients. We're all collectively going through this experience. But my breathing and remaining calm in the situation, my saying, wow, these are some really big feelings right now. You're okay. You're allowed to feel angry right now. However, you are not allowed to hit your brother, right? So we need to allow space for big feelings in our home. And if we don't know how to handle our own big feelings, if we don't have tolerance or coping skills for our own big feelings, it is very difficult for us to sit with our child's big feeling. So modeling these big feelings for our kids doesn't even come down to having all the feelings books, having all the conversations. It really comes down to being able to take deep breaths and calm ourselves in the moment and be able to regulate and co-regulate with them and teach them these skills in the moment.
I think that's great. And I love that you hit with not only what we do for the parents, but really with the kids. How do we start to have these conversations? How do we model it? And how do we encourage the emotions? Allison, Dr. Mark, anything to add for kind of recognizing, encouraging our kids or teaching them how to feel these emotions?
I think one of the big things is to recognize that we are beings that are made up of energy, and emotional energy is one of those things. And I used to work a lot with juvenile justice and gang intervention work in the inner cities of Denver. And the joke was that a kid could spot a fake a mile away. Well, our kids can do the same thing when it's we say that we're fine, but the energy that we're carrying. So, like Eric said, just that it pops up in different ways. The energy that we're carrying really affects the mood of the home. And so, I think one of the things that I really encourage my parents to do is, you don't have to fix it, just recognize it and be vulnerable about it, so that there is continuity and not, mom and dad this way, but the house feels this way, something's missing, and that's where it disrupts even more. And so being very honest inwardly and then honest outwardly, and being very vulnerable with the kids and the family is, I think, really important, because now there's continuity. Now it makes sense. Okay, the house is feeling this way because mom and dad are struggling right now, and they're being honest. We don't tell them all the adult stuff, but we are honest with where we're at. And then it goes back to the modeling piece. Now we're modeling, okay, now they're watching us on how we work through it. And if we mess up, we repair it, and getting on their level, apologizing. But, they are always watching. And so they're learning more from watching us than they do a lot of times from what we say.
Mm-hmm.
I think that's awesome. And Allison, I'm going to jump into this next question because I think Mark hit on it and it's perfect.
Mm-hmm.
One of the things we're also seeing during this time is a lot of strife in relationships. The relationships are struggling more than what they may have been before. It's bringing to light deeper issues within the relationship. How are you approaching kind of the marital conflict? How do you coach, or, I know a lot of our viewers are probably going to say, do I stick it out because we're in this weird time? Do I move towards divorce? How do I co-parent right now with this? What are you recommending in the relationship side of the mental health burden?
Well, let me just normalize, some of the feelings people are having. I forgot about my husband just now. I completely forgot about him, which really to me sums up that, there's times that we feel very much alone and isolated, even though we're so close to our partners right now. One of the biggest themes of this pandemic is feeling a lack of control in our external world. And so I think what that does is trigger feelings of wanting to be in control of our world inside our home, our intimate relationships. And so that obviously includes the marital relationship. And a term that I've been using quite a bit in the last several months is this idea of the natural cadence of our lives. We're used to going into the office. We're used to going out with friends. We're used to having time with our partner, without our partner. And all of that has largely been interrupted. And so I think it's really important to acknowledge and just normalize how hard it is. It is a challenge to be married in the best of circumstances right now, and to live under the same roof with your partner, to not have your own space, to not have that commute to work, to not be able to go visit friends. I haven't been to my book club in 4 months. All of those little things that helped us kind of have our own individual identities have been taken away. And then, of course, it amplifies, dynamics that are strained between us. Add on top of that social media. So, of course, everybody is posting how much they love everybody and all the, fun family things they're doing together during quarantine. Nobody's posting, I just got into an all out brawl with my husband, where we needed a referee. And so we get a lot of pressure that we should be fulfilling this role. And there's this kind of feeling of we should all be sheltering together and sheltering in place. It's not always that easy. So my recommendations for clients have been, first of all, to be accepting and to give themselves some grace and space, to create some space for that conflict, for those big feelings they have towards their partner. But then also I am encouraging them to work on it. I've had many clients that have ended up bringing in spouses into sessions to talk about things like communication. And a lot of the things we're discussing are things that can kind of easily be worked out with the right kind of support. So the other thing I'm going to really emphasize is self-care in your identity as a person, as an individual, and how important it is to maintain that. I am a wife, I am a mother, I am a therapist, and I am me sort of comes last. And it can be very easy to feel resentful of those other identities if you don't put yourself somewhere in the list. So practicing proper self-care, outsourcing as needed in terms of, a therapist, if you feel like it would be helpful. If you're having financial difficulties, meeting with a financial advisor. If you're if your child is struggling with school, meeting with somebody who can help you kind of navigate those challenges. But then at the end of the day, also cutting yourself some slack and giving you and your partner some grace and, some space when you do it.
Awesome points. I think those are really critical and a lot that everyone can take away depending on what they might need in the moment for their relationship. Eric, I'll start with you. Mm-hmm. Anything else you would add about the relationship space and what can be done?
I think that it's important to recognize that our regular means of coping, especially for a lot of moms or on mat leave or social coping, has been stripped. So we've got two different kind of ways that we cope. We have coping skills that involve other people and relational and social coping. And then we've got our more individualized coping. And so many moms, women really rely on that social coping piece, going for dinner, having a glass of wine, seeing a mom friend, doing a stroller fit walk with baby, like to air out maybe the tension in the relationship, or to just process their feelings of what is going on. Those coping skills, those social coping skills, have been very limited, restricted. They've been, put online and changed in so many different ways. So I'm really challenging the moms that I work with to go deep into their solo individualized coping skills. We've got this toolbox of skills, and some of us may not have ever put any individualized coping skills in that box. We may have relied so heavily on the social ones that now we're feeling kind of like we're floundering and we don't know where to go to get some relief, to feel rejuvenated. Play and creativity are my two biggest ones that I encourage moms to dive into. What is something that you do for fun, just for the sake of doing it, and how can you engage in that at home? For me, it's photography. For others, it's making or crafting. For others, it's, design or like some sort of illustration. It doesn't have to be artistic, but creativity. Like, how do you, curate some of these individualized coping skills in your own life?
That's an awesome suggestion. And just when you said that, I kind of thought, what's in my individual toolbox? And I encourage everyone, in the comment section, what are you doing that's your individual one, your standalone? We'd love to hear from it. Dr. Mark, moving to you, I think we'll touch a little bit on the relationship, and then I want to dive into our heavy topic on suicide.
Sure. I'll just be real quick. I think I totally agree with Erica and Allison on all of this. But just the last addition to this is, I really think that we need to make sure that we're not holding on to psychological expectations. We need to verbalize our expectations of our partner, if it's a safe place, right? And so if it's a safe place, I think a lot of times we hold on to psychological expectations and the shoulds come out. You should have known, you should have expected, you should have met my need this way. And not being afraid to really put those out there and just go, here's what I need. I'm going to verbalize it, and then asking for self-care, or like Allison said, that cadence. I call them rhythms, and the same thing. And it's, how do we get back into some rhythms at home that allow us to go from being busy to self-care, to being a mom or a dad, and then to self-care, and and kind of bouncing back and forth in a way that is a healthy rhythm is going to be really important.
Excellent points. And one of the topics that we find people are kind of nervous to always talk about when we want to address head on is the pandemic. While it's always kind of in the background, we do see suicidal ideation becomes more prevalent, especially during times of crisis. And how do we have open discussions and normalized discussions, not only within our social groups, but especially with our children, about suicide and how that affects us?
Yeah, this is such a hard topic. The suicide hotline has increased almost 100%, if not more, in phone calls since the pandemic has started. We see an increase in 25 to 30% in just the month of June and July of Generation Z and millennials struggling with anxiety and depression. So this is a very real topic, and I think the myth out there is that if we don't talk about it, it won't happen, and that's not true. It's all over social media. There's just things out there that are, just make your stomach turn. And so we need to talk about it in a safe place in our home. And so, I am a suicide survivor, and I use that as just a conversation to start, but my 12-year-old daughter knows my full story because she, age appropriately, she's able to handle it. My 7-year-old doesn't. But my 7-year-old knows that daddy struggled with anxiety and depression to the point of despair and hopelessness, and so using age-appropriate language, age-appropriate conversations, it needs to happen from, early on. I mean, I remember a client coming in once where their 5-year-old was talking about suicide because they heard somebody at preschool talk about it. Like, oh my goodness, like we just don't think about those things, and so how are we having those conversations? And I think a lot of times when we get to the conversation around suicide, it at times can feel like it's too late. And so what are we doing to build an emotionally resilient household? And so what are we doing in having conversations? Everything that we've talked about so far today, what are we doing about being real and authentic and sharing as parents when we're struggling, ask our kids, Daddy's feeling really sad today. I had to make some hard decisions at work. So tell me, when was the last time you felt sad? And what was that like for you? And so really engaging in those conversations around the dinner table or the couch playing a game, or just in passing as you're driving someplace, or creating those opportunities. I not trying to placate the suicide conversation or to minimize it, but I tell parents a lot of times, if we're talking about suicide, it's almost like divorce papers being put on the table out of left field, and we're not ready. Like we have to work really hard to either engage that conversation around divorce and maybe get supports, or go down that path of divorce. With suicide, it should be, a long conversation about emotional health, mental health, spiritual health, physical health. And yes, we need to insert those conversations around suicide. So not to be afraid, but there's a lot of good resources out there. And it's something as simple too as calling up your local counseling center and just asking what kind of resources are available, to utilize that conversation. And I could talk about this forever. So,
It's a deep topic. It's a heavy topic. Erica, Allison, anything you recommend both on how to address this topic, and then also ways for people who may not have ever sought out help? Where do they start? How do they seek out help?
I think that in working with moms, I often encourage them to seek help before we're in crisis. Right. So I shared a post on Instagram this week about how if we're questioning, should I get help about this? That's a red flag that you need to think about getting some help, because whether it's speaking to your doctor, whether it's speaking to your therapist, there is no harm to come from getting early intervention. Right. So red flags and things that I notice that come up with moms are things like saying, should I get help for this situation? Is it bad enough to get help? Well, I think that we should kind of flip that mentality a little bit to say, like, if we're struggling, we need to get help. Often clients wait until we're in active crisis mode to seek out therapy. And we sort of, we tune out, or maybe aren't attuned to all the red flags that have come before that to tell us that we're not feeling okay, we're not doing well. Things like saying, like, I don't really feel like myself. Like, that's something that moms utter to their partners, big red flag. And like scary and intrusive thoughts. So if we're finding that we're entertaining scary thoughts, whether we're distressed by them or entertaining them, those are also red flags early on to find some support and to speak it through with somebody.
Huge.
I was just going to say, my perspective is a little bit different in that I guess I want to address how to handle it with adolescents, because I do a lot of work with adolescents and teens. And I just want to say, one of the most frightening things for me as a therapist is how many times I hear from teens that they are trying to be the support system for their friend who is suicidal. All the time I hear, I'm the person that they call, I'm the person they go to. And it's such a frightening concept as a mother and as a therapist, seeing the potential implications it could cause for 15, 16-year-olds to be putting this kind of pressure on them. So I think as a mother, I don't have teenagers yet, but it's in the back of my mind to have an open conversation with my children that, first of all, obviously about suicidal ideation regarding their own mental health, but also how it relates to their relationships with their peers, because I would never want them in the position where they're trying to manage that. I've learned in my practice with teenagers that teenagers love to manage things amongst themselves. And so I break it down really simply for them and say, I've been doing this for 10 years and I don't attempt to try to talk somebody out of committing suicide. That's a very serious thing that needs to be handled by somebody who specializes in that. So I think talking to your children, because the likelihood is that they have been exposed to this through peers. And again, that's a very kind of like niche part of this conversation, but I think an important one.
I think that's great. And one of the questions that we got from our audience is, where do we go to get resources that are age appropriate on suicide to begin these talks? So we've seen like the 6 to 8 year olds, kind of the preteen and the teen, is even, I think you could start it earlier. Where do we go for these resources, Dr. Mark?
There are a lot of good books out there that are age appropriate, maybe not so much about the suicide conversation as a whole, but about mental health. and about what I do with these big feelings inside. And there's a lot of great resources in that. Kristen, I can, if it's possible, I can send you, a PDF of some of the resources that I utilize that you can push out if you'd like. And I think, I do think, I appreciate some what you said about, teenagers and current, and that piece. I think one of the big things is the greatest resource is ourselves. Greatest resource is that presence and that sitting with and wrestling with. And so there are a lot of good books out there for us as parents that we can equip us to be that presence and that space for our kids. I think a lot of times those books books or resources do help us start the conversation. So I'll send that out. I've got it someplace buried in my computer. So.
No, thank you. That's awesome. We'll make sure that we share it with this group and on our socials. Allison, Erica, anything to add on your thoughts on this topic? And if not, I've got one more rapid fire question.
So many thoughts. I actually have a maternal mental health podcast that walks moms through when to intervene, how to, navigate postpartum depression. I bring on psychiatrists, all kinds of specialists. So it's the Happiest Mother podcast. And it is endless conversations like this that are really deep into motherhood and our mental health and how we regulate ourselves through this journey of motherhood, which is the work I didn't expect to sign up for when I became a parent, but it's 95% of what I find I have to do in the day. So I'll leave you with that. And we speak on lots of topics on the podcast.
That's perfect. Erica, any final thoughts from you as we go into the holiday season and we normalize these conversations for others?
So I think that the normalization, I think, is the key. This idea that we're not alone, this idea that, one of the things that I've shared with clients is that very rarely are therapists dealing with like the exact same issues that so many of their clients are dealing with. And so this idea of not feeling isolated, this idea of feeling connected with people that are experiencing the same things that we are, this idea that you can't screw this up, you can repair things, you can make things right again. I I'll have a moment where I'm frustrated with my children. And like I said, I get down on their level and say, I'm so sorry. I let my feelings get the best of me. And I could have handled that differently and process it through them, with them. And I think that that's really should be our goal, not being perfect. And mothers oftentimes get that pressure.
Such a great topic. There's so many great points. I know this is going to be one of the heavy re-download parts of the summit because there's so much here that people can take away from. Allison, Erica, Dr. Mark, thank you so much for being with us today. So value your insights and your guidance for helping not only our mothers, but our parents as well kind of navigate this, what's becoming the new normal. So thank you so much. And we will share your contact information as well. So thank you for joining us today.